Good day, and welcome to the National Bone Marrow Transplant Link Cancer Fatigue and Getting Through the Holidays conference call. Today's conference is being recorded. And at this time, I would like to turn the conference over to Ms. Jennifer Gillette. Please go ahead, ma'am.
Thank you so much. Yes, my name is Jennifer Gillette, and I am the staff social worker at the National Bone Marrow Transplant Link. I'd like to welcome you to our Lunch and Learn with the Link today. This month's program will focus on surviving the holidays with fatigue. It's our goal that today's program will inspire you and equip you with a new skill or idea as you learn how to go through this journey. A special thank you to the Leukemia and Lymphoma Society and our Link partners for making this program possible today. Today's outline will go as follows. I'll give you a short little introduction, and then we will have our professional speaker, Christina Ferraro, for about 20 to 25 minutes. Then our survivor speaker, Spin Zucker, for about another 10, and then we'll open the floor to questions and comments. We'll also provide a couple resources at the end, so stay tuned. For those who may not be familiar with the link, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are our webinars, podcasts, blogs, and lunch and learn calls for a variety of topics, such as our chronic graft-versus-host disease, caregiving, coping treatment options, and survivorship after transplant. We also have our peer support mentor program for patients, caregivers, and donors. We have our second birthdays recognition program, and we have several books and referrals that we can make for people that are needing resources. We also provide books, referrals, and emotional support from a licensed social worker. We provide a variety of other educational and support opportunities, such as the call you are on today. So please feel free to reach out to us if you're interested in any of our services. Before we begin today's program, I'd like to review just a few housekeeping items to maximize the experience of all on the call today. Due to a limited amount of time, the facilitator will need to make sure each question or comment does not go longer than necessary. Please also only ask one question at a time. You can always get back in line if there is another question you have. Please know the information provided in this program is meant to stimulate conversation with you and your own healthcare provider and is not meant to replace your individualized medical plan. Now on to the educational part of our program. We are so excited and honored to introduce you to our first speaker today, Christina Ferraro. Christina completed her Bachelor of Science in Nursing at The Ohio State University in 2001 and received a Master of Science in Nursing and certification as a family nurse practitioner from Kent State University in 2016. She joined the Cleveland Clinic in 2003 as a registered nurse on the inpatient blood and marrow transplant unit and became an outpatient BMT nurse coordinator in 2006. Christina currently leads the Victor Fazio BMT Cancer Survivorship Program at the Cleveland Clinic and has experience in seeing patients with graft-versus-host disease and patients in a long-term follow-up, emphasizing patient empowerment, education, and support. Christina is an active author, presenter, and educator on the topic of BMT and survivorship and participates in research focused on survivorship and post-transplant complications. So please join me in welcoming Christina.
Thank you so much for having me. This is a really big topic, and it's a very important topic, especially for patients that I follow, and I'm sure all of those who are listening in or who will listen in, this impacts you and your families, I'm sure, on a daily basis. And so today we're going to do a little overview and maybe give you some tips on how to make the fatigue a little bit more manageable, maybe improve a little bit, maybe figure out a way to compensate and get you through the holidays. I have not been diagnosed with cancer, nor have I had a transplant, but I know the holidays can be tiring on their own. And so when you add the diagnosis of cancer and then cancer treatment, it can be very overwhelming. So one of the biggest complaints or things that people report to me is fatigue. And they really just want answers of how to make it better. And it's a very good question, and it's kind of a loaded question because we know that there's a lot of pieces that can impact fatigue. And when I talk about fatigue, I'm not talking about I'm tired because my dog woke me up 3 times last night to go to the bathroom. This is, I just slept 8 hours. I could go back to sleep for another 8 hours. My body is tired. I just can't do the things I want to do. It's very personal. It's different for everyone. It doesn't look like something on the outside. So family who don't know you, who don't live with you, may have a difficult time understanding what that is for you. And that sometimes can be very frustrating. And so how do we get through that? There are things that we can do. There are things that we can change, but there are also things that we cannot change, either you or your healthcare team. So what can't we fix? The fact that you've had cancer diagnosis, the fact that you've had to have treatment for that cancer diagnosis. We're all getting older. We all have other things going on in our life, maybe other diseases that impact that fatigue or that overall health. But there are things that we can do something about that can impact fatigue. So we know pain can impact fatigue, depression, nutrition, muscle, sleeping, or the lack thereof sleeping, anemia, which is low blood count, other diseases like diabetes, abnormal thyroid, abnormal hormone function. So what do we do about it? So it's important that you tell your team what your fatigue is. And then I always ask patients, how is your fatigue? Not do you have fatigue? Because it is pretty common. But if you're not asked the question, it is important that you tell your team that you are fatigued, that you're tired, that you're not able to do the things you want to do. Getting pain under control is important so that we can make you more comfortable in order for you to be able to do some of the other interventions that are able to help with fatigue. Depression can often impact people's ability to sleep well, to do activities, to find enjoyment in things. So knowing if you're depressed, making sure we're treated for that. Poor nutrition, so if you're not eating well because your appetite is low, those things can also impact. If you're eating a lot of sugar, that can impact your overall well-being because that can make you have these spikes in energy and then it brings you down. Muscle fatigue. So patients after treatment are very fatigued. They lose muscle because they're not feeling well, so they're not as active as they have been. And sometimes some of the medications that you're on can waste muscle, like steroids. They're wonderful, but they're also terrible. So those things can be very difficult to overcome. Insomnia, poor sleep habits. Sometimes the medications like steroids keep you from sleeping and keep you from sleeping well, and that can be very difficult. Other things can impact it, like sleep apnea, which means that you're not sleeping well because your body isn't breathing correctly at night, and it basically wakes you up to make sure you are breathing. And so you're not sleeping well. You're not getting into that REM cycle. Low red blood cells, we need to boost you up, or if we can't, we have to figure out a way to make sure that we're compensating and keeping track of those counts. And then if your thyroid or if your hormone levels are abnormal, fixing those can make a difference. We do a lot of symptom management, and some of those symptoms we can get better and some we can't. And so it's important that we look at what the side effects of those medications that we try are also. So just like prednisone can cause insomnia and fatigue and muscle wasting, we know that pain medications, antidepressants can also cause some fatigue. And so that can impact your day-to-day life. So we have to balance that out with preserving the energy that you do have. If you know that the mornings are your good times, then you need to focus on doing what you need done in the morning, because by the afternoon, you're going to need a nap. or you're going to need to take a break. You have potentially just so much energy in a day. And if you overexceed that energy, whether it's a good day or a bad day, you may pay for it for a few days. And that can really impact what you're able to do later. There are lots of options out for how we can try and improve fatigue. And one of the biggest ones that we have found that works is exercise. So muscle building helps with the fatigue. It won't take it away, but it will minimize it a little bit, especially in those people who are very severe fatigue. It's very difficult, though, to go from zero to working out. Like, I could not even, where do you start? So what do? There are physical therapies. There is the different programs out in the community through maybe the cancer support centers that are out. They have free classes a lot of times that start you very slow with yoga and stretching and some of those things just to get you out of the house and get you started. Live Strong is a program that's run through the YMCA. You do not need to be a member of the Y to participate. And they have a program that's specifically designed for cancer patients to help them start working out, start exercising. And they will cater that to where you are. And patients who have gone really enjoy that. Chronic fatigue may not completely go away, but we want to try and adjust and modify what we can. So exercise isn't just going to help with muscles, but it also helps with your mood. It helps with sleep. It helps keep you at a healthy weight. It protects your heart. It actually decreases the risk of breast cancer and Alzheimer's and cognitive dysfunction or decline and memory issues. So that sometimes can impact people's overall well-being. Any amount of exercise is beneficial. So when I say to start, I'm talking 5 minutes a day. And that's it. That's where you start. Because it's very difficult to go, okay, I know that the guidelines tell me 30 minutes every day. That's not going to happen. And so you have to set smaller goals and work to those smaller goals over a gradual amount of time. I also tell patients that it may take months to get to that first goal, and that's okay. And being patient with yourself is very important. It's very easy to get frustrated. You're used to doing all of these things and being independent, and then when you're not able to do those, it can be frustrating. And that can cycle back into the depression and anxiety, and that's where mindfulness and some of the non-physical activities, relaxation, some of the meditation things, cognitive behavioral therapy, so retooling your brain and thinking about how to motivate and how to restructure your day. Those are the things that can help improve quality of life because you're not worried about getting to that final goal. You're focusing on your short-term goals with the eventual getting to the long-term goal. Making sure you're getting enough protein in your diet, making sure that you're getting healthy fats in your diet, minimizing simple sugars, caffeine, alcohol, because those can all impact not only your sleep, but it can spike your energy up and down. Making sure you're staying hydrated, at least 2 liters of fluid, non-caffeinated beverages a day will help. Good hygiene, sleep hygiene is hugely important. So this is the big thing that people, and I also have this problem where I read in bed, I play on my phone in bed, and then I wonder why I don't sleep very well that night. And really, you shouldn't be in front of a screen for about 30 minutes before you go to sleep. And that's because your brain is stimulated by the flickering lights and the lights off the phone and the lights off the TV. And so it never has a chance to calm down and settle down and turn off. Really should be only sleeping and having sex in bed. It should not be a place where you read or watch TV. If you want to read, you read in a chair, and you can do it in your bedroom. We just don't want you in bed. You're sort of training yourself like a puppy. Like, you're going to go and sleep in this area. And that's what only thing you do in that area is you sleep there. You want to make sure you're not eating or drinking caffeine too close to bedtime. It can increase your risk of stimulating your brain, but also reflux, which can be uncomfortable, so heartburn at night. There are a few medications out that we have used for sleep or for fatigue, and some of them are used for ADHD, like Ritalin or methylphenidate, and then there's also the classification of a non-stimulant that helps with people who have narcolepsy, who kind of keeps them awake during the day, called Provigil or Nuvigil. Those medications are really a Band-Aid, and they're great Band-Aids. They're great for when you are trying to do something really important, like it is Christmas Day and you want to have energy through the day and you want to be able to have the stamina for the whole day, and you would take these pills, and this would get you through the day. The longer you take these every day, the less likely they are to work. So you sort of become used to them. So taking them only as needed on the days that you know you need that extra burst of energy is better than taking them on a daily basis. Maybe it's those days that you know you're going to go to the gym, you take one of those medications, you go to the gym, you're able to get through that exercise program. And then in the long run, you will need that medication less. Sometimes we can make impacts and sometimes we can't. So what happens when you basically do all of these things? You can maintain your physical well-being, you can maintain a certain level of fatigue, but you can't really improve beyond that. That can happen. So how do you do the things you want to do? Planning. And planning can be very difficult for people, but just like we all tell you, you have to meal plan and you have to plan what you're going to do at work, you have to plan your activities. So you look over the course of the week and you say, I need to get these things done this week. And you plan Monday, I'm going to do these things. Tuesday, I'm going to do these things. And you go through the day. You go through the week and you say, okay, this is my plan. Now, if there are things that are needing to be done that are not able to fit into those 5 activities per day that you're physically able to do, that is when it's time to ask for help. And that can be very challenging for adults in general, to ask for help. We all want to be able to do it by ourselves, and it's not as easy as it used to be. And it's okay. It's okay to ask for help. People want to help you. Family wants to help you. And if you give them something to do for you, that gives them a sense of joy, especially during this time of the holidays when there are all these things that are happening and you have to prioritize what is the most important thing for you to be able to do. Some of the things like doing the dishes, somebody else has to do, or doing the laundry, or some of those. Trying to tap in those backup plans. And know that if you have a bad day, you take that bad day and it's okay. And the next day you regroup and you start again fresh and work on doing the things that are the most important. I could talk about this for a very long time, but I want to make sure that we have lots of time for questions and answers. So I'm going to pass it to our other speaker, and then we can talk back and forth.
Great. Thank you so much, Christina. That was some great information, and we really appreciate you helping us out with this call today. Our next speaker is Spin Zucker. Spin is a retail manager from South Windsor, Connecticut. He is currently 60 years old. He is on the board of directors for Brotherhood in Action and his temple. Spin is a myelodysplasia survivor that has an allogeneic transplant back in August 2002. His donor was a female from East Germany. He knows firsthand how challenging fatigue can be, and he has an infectious positivity and is currently a peer mentor for nbmtLINK. Thank you so much for joining us today, Spin.
Thank you for asking me. I appreciate being on the call today. I listened intently to Christina's presentation, and I feel like I just need to echo several of the points that Christina brought up. And two of the ones that I found most poignant were the nutrition and the exercise parts of her talk. So touching on nutrition first, as a patient and as I was recovering, I know I had my nurses and doctors tell me how important it was to eat and how that's an essential part of my recovery. But when you're in bed or you're in your chair and all food tastes like styrofoam, you really didn't have a desire to eat. But after listening to the nurses and the doctors and the nutritionists explain why certain nutrition is going to be better for your body than not eating at all, you realize that whatever tastes awful and doesn't taste at all, because pretty much everything is bland, everything tastes the same, it was important to make that big step and start eating vegetables and taking vitamins and eating things that had protein in it and avoiding the junk food. I clearly remember that I didn't want to eat, and I know my one of my nurse oncologists said, look, if you don't eat, what we're going to do is we're going to give you nutrition through your catheter or through your port, and then you'll never eat again, and you'll be dependent. You know, in essence, she frightened me to start eating again. And I was down to 2 pounds from like 140. So, I was at the point where, I got to make a mental decision to turn around and start eating properly. So what Christina said about eating good, avoiding caffeine, avoiding sugars, and just sticking with proteins, grains, and good healthy stuff was important for your nutrition. And that goes right into the next thing, which was the exercise. So the last thing you feel like doing when you're recovering, that I felt while I was recovering, was getting up and moving. I felt like I want to sit in this chair and I don't want to get up and I don't want anybody to bother me. I just want to lay here and, leave me alone. But again, you need to start making baby steps towards recovering the muscle atrophy that you have and the fatigue that you have. And the exercise is really the key to coping with the fatigue. So I started out I had a friend that dropped off a treadmill at the house. And I started out with maybe 5 minutes of walking on the treadmill because it was wintertime in Connecticut when I was recovering. And going outside, in sub-cold weather with, the mask on and the gloves on, and just didn't seem conducive to me. And I kind of felt weird, like the neighbors would all look at me and say, why he's got no hair and a mask? And, so I felt exercising at home was best for me. So I would start out maybe the first week with 3 or 4 minutes on the treadmill, then maybe 5 or 10 minutes on the treadmill, just walking very slow pace to get the muscles back in shape. And that also goes to the fatigue, because as you gradually increase your exercises and you kind of feel like, okay, I've reached a plateau and now I can rest. And disruption of sleep at night was a big issue. But if you exercise late in the afternoon and then you go to bed, then you sleep much better. So it goes hand in hand, and that the rest also is a combatant to the fatigue. Your sleeping patterns when you're recovering are all messed up. You wake up with dreams, you wake up with, noises, and you sit awake at night wondering what's going to happen to me, how's this all going to end? And the exercise and that helps you sleep more peacefully. And then you just pace yourself for using your exercise tools to get in better shape and to build up your body and build up your stamina. So just to echo what Christine said, she pretty much hit it on the nail. And my personal experience shows me that as long as you don't push too hard and you rely on your support group when you have them available and they offer help. You can ask for help. It's fine. People want to help you, like Christina said. Anything that you could throw at them, like, if you could just please, get me a small 2-pound barbell and I could just, do exercises with my arm, they'd be thrilled to help you out with something like that. So relying on your friends, your families, your caregivers, it brings them into it, and then they can see your accomplishment as well. And that's fulfilling to you as you're recovering, because especially I can see at the holidays where people want you to be happy and they want to see joy and they want to see you thrive. And even though you're thriving slower or slowly, you're still thriving. So, that's about what I can add, unless people have like specific questions. I can throw it back to Jennifer. And I appreciate you asking me to be on the call.
Well, thank you so much, Spin. We really appreciate you being here. And as always, you were inspiring to all today. Okay. Can we please advise the callers on how they can ask questions?
Certainly. Thank you. If you would like to ask a question, please signal by pressing *1 on your telephone keypad. If you are using a speakerphone, please ensure that your mute function is turned off to allow your signal to reach our equipment. A voice prompt on your phone line will indicate when your line has been opened for your question. Again, press *1 to ask a question, and we'll pause for just a moment to give everyone the opportunity to signal. And we will take our first question.
Hi.
Hello.
So my question.
Hi.
Hello. Eye cancers, pre-cervical cancer when I was younger, malignant invasive melanoma about 5 years ago, and then I have been diagnosed with a chronic leukemia for the past 3 years, which I'll have for a lifetime unless they find a cure. And I've been battling pretty severe fatigue since, which is what actually alerted me to the fact that something was wrong. And even after all of these years, I still find that friends and family just do not understand what fatigue is. And they relate it to being tired. So I appreciated what the speaker said about tiredness is not, fatigue is not just being tired and being woken up in the middle of the night and losing some sleep. I prefer to sleep at least 10 hours to feel even slightly functionable. But I have been in a relationship now for the last year and a half, and I really feel like my boyfriend does not understand what fatigue really is and why by the time he gets off work and by the time he gets here, I'm too exhausted. And so I was wondering what you guys would offer in terms of how to tell people to get them to really understand.
That's a really good question. And I think patients in general, and whether they're cancer patients or not, anyone who has chronic fatigue, it is very difficult to explain this type of, it's invisible. It's an invisible illness. And that's one of those things that if you had your arm in a cast, you could easily show someone what that looks like. Fatigue is not something that's easily described. There are some articles out there that people have written that describe fatigue from their perspective, and it's not necessarily a cancer patient, but from actually, I believe, an autoimmune disease patient explains it like, I have 5 spoons, and those 5 spoons represent the activities that I'm able to do in a day. And I use those spoons every day. And when somebody asks me to eat another bowl of soup, I don't have a spoon left. There is no spoon. There is no way for me to do anything else. Like, I've hit the wall, I'm done. And that is their explanation of how to explain that really you are limited based on your energy load, what you are able to do per day. And no matter how much sleep you can get, that doesn't fix it. because it's not about how much you sleep. I mean, yes, sleep can impact your fatigue level, but chronic fatigue is not going to get better the more you sleep. And so I wish I had the perfect answer to help you with him and to help people tell their loved ones and their friends and family what that is. I think you just have to continue to reiterate with them that it is something that's real. There is lots of information out there. If you look online at lots of these cancer support groups like Leukemia Lymphoma Society, all of these groups have a lot of information on chronic fatigue, especially related to cancer. And I think it's important that if your family and friends don't quite understand, find them the articles for them to read to help them understand. Maybe they need to read it from somebody other than just you. That might help.
Mm-hmm. Yes, for sure. That's very true. And actually, you are reminding me. I remember LLS came to my one of my many cancer centers, and I do remember there being an article. So I'll do that. I'll try and find that. I think and I know from other people that one of the big things is that, like you said, it's invisible. And when I see people or I post a photo on Facebook, it's, oh, but you look great though. Like they just assume because you look good that you feel good.
Yeah, looking good and feeling good is a little different sometimes.
Well, I kind of feel like people generally knew what was going on, but yeah, they don't understand, why you can't get up and go out and why you just have not a lot of energy and fatigue. And, we all can appreciate that as patients, but the people, like you said, that don't have that experience, they just can't really relate to you. And explaining that the fatigue is a real thing is difficult to do. So yeah, I know it's going to be a challenge, but reading material is probably the best.
We'll move to our next caller. Caller, your line is open. Please go ahead.
Hello. I have a couple questions. My husband was recently diagnosed with a rather rare subtype of non-Hodgkin's lymphoma. And so he went in for his first cycle, which was inpatient of chemo, and then he came out, this is only 2 weeks ago, and just didn't do very well, and then had to go back in the hospital for infections and just got out Monday. And the fatigue piece, in addition to the infections, so I'm sure that everything played into it, but he just can't seem to wrap his head around the fact that he never feels rested. And he had, taken Ambien before he went in the hospital. We've gone off that. The hospital, has recommended some, I think they would be called antidepressants that also would help with initiating appetite, but also have a drowsy effect. But my question, I guess, because he just seems to be so sensitive to medication is, I haven't really heard much about medicinal marijuana or marijuana used to aid in sleep or relaxation, which might lead to sleep. Can you talk about that?
I actually do not recommend marijuana. From the Cleveland Clinic, we really don't have a stand. We don't recommend it in general. There's no data out. Unfortunately, there's no evidence-based practice. It's all very personal and subjective data out about that. And so I don't have any recommendations. I do know that there are pros and cons to everything. And so it is important, if you decide to look into it, to make sure that you get information completely from every angle, not to just get it from one side or the other, to make sure that you're making the best decision for you.
Okay.
One thing I'd like to add to that is there is research out, too, that is showing actually long-term use of marijuana can actually increase anxiety and depression, where, so that's one thing to take into account. But another thing I also want to add, too, and this is Jennifer, the social worker, by the way, is that they're finding the CBDs and the marijuana, that kind of acts like a grapefruit, that it can actually increase the medications in the system, kind of like if anyone takes like a cholesterol drug, they're not supposed to have grapefruit because it can increase. And so it can have the same effect with some of his medications. So I just want to echo what Christina was saying, that if you even dabble in that area, that it's really important that you really do your research and include your medical team in what you're doing.
Okay. So given that I've read a lot and I've listened to what you said, is it possible to, like, I've kind of even videotaped my husband sleeping because he sometimes doesn't believe he slept, but I will say that even my videotapes show that his lips might be moving or his finger might be moving, so I'm assuming that's not really deep sleep. And is it the deep sleep that's lacking and leads to that kind of feeling of I'm exhausted or what?
It's actually the REM cycle, which is like the dream state cycle that sometimes is what's associated with like good sleep. If he's in active treatment, it's going to be really difficult because a lot of times I don't know exactly what regimen he's on, but they do use a lot of steroids within lymphoma protocols a lot of times. And so that can definitely impact sleep. So using a sleep aid is a lot of times used initially, especially during active treatment, because of that sleep disturbance from the chemotherapy regimen and because of all of the other side effects you may have with it. So the nausea, the fevers, the infections are going to compound it. It is going to be challenging. One of the things that you can do to help with him is just make sure he keeps moving. He may need a lot of naps during the day, but make sure he gets up and walks every day and stays as active as he can, only because that will help him in the long run. Short term, he may just walk for 5 minutes and then need to rest and take a nap, and that's okay. It will help him recuperate after he's completed all of his cycles.
Okay, thank you.
Next caller, please go ahead.
Oh, hello. Thank you for doing this Lunch and Learn. This is great. My daughter, I'm the caregiver. My daughter's 18 now, and she was diagnosed in January 2017 with Hodgkin's lymphoma and then relapsed and had a stem cell transplant, and she's in remission now. And my question is, she's exercised since day one, has always moved and done something, which is great. And she's dealing with a lot of side effects from the clinical trial she was in, so she has significant peripheral neuropathy, but she swims and she walks every day and she tries to dance and she does all that. But she is constantly, I'm tired. And she's also a senior in high school, so that could be a lot to do with that. And I noticed at Thanksgiving, she got through it and she was just really down. And I don't know, what is it about the holidays that can affect these patients that have gone through so much, and what, as a caregiver, can I do to help without drawing too much attention to what she's been through, because she tries to put that aside?
Well, congratulations. I'm glad that things are going well from a disease perspective. I do think that the holidays in general are going to be very stressed. One of the things that the holidays can bring up is a lot of emotions. And sometimes after transplant, I do tell patients, even if they're doing really, really well, that sometimes they can get PTSD, so post-traumatic stress disorder, which can cause anxiety and depression after they've recuperated from everything. She's doing all the activities. She's a senior in high school. But this could be triggering some emotions that she hasn't quite dealt with. And she may or may not benefit from talking to a professional therapist about it, because I do think that everybody benefits from talking to a professional therapist, whether you are a patient or not. I do think that helps, and she may feel more comfortable talking to somebody other than her mom, only because she doesn't want to stress you out, potentially. And she may just find it emotionally more stressful because the holidays there's a lot of activities. And so I don't know what the rest of it, but adding another activity onto her already busy schedule just may have been one spoon too many.
Yeah, I'd like to add to what Christina just said also about the, PTSD in a form that, most of us don't understand that haven't been through that. So when you're recovering, you feel like you're carrying the weight of the world on your shoulders. You don't want to disappoint your parents. You don't want to disappoint your spouse or mom or dad or brothers or sisters because, you want to get through this. You want to show them how strong you are. And then when you're past that and you look like you're on the road to recovery, it's kind of like a big, giant exhale. And sometimes you want to just draw inward and just say, I put on my best face. I did really well. Now, give me some me time. Give me some alone time. But no one wants to give you alone time because everybody wants to put their hand in and help you and stuff like that. So I think it's a natural reaction that she's having, and I know I felt that as well. And I think the suggestion of talking to somebody, whether it's a professional therapist or somebody that's set away from the family, from the immediate caregivers, I think is a fantastic idea.
Okay. Well, I think I'd like to add on to what Christina said, in regards to that is, anytime a holiday comes up, it is a reminder of just you not being maybe the way you had been in other holidays. And so that can certainly trigger grief further. That's just part of the journey. And if she has a therapist, certainly that therapist can help her with that grief. But another thing too, I encourage for people over the holidays is to have flexible thinking, to think about, perhaps you could ask her what are some of her favorite parts of the holidays. And even if she doesn't have the energy to do all the things she used to do, if you focus on the most important parts to her, even if that requires some adaptation. I know in your daughter's case, it sounds like she's doing better physically, but there might be some people who maybe are stuck in bed and just don't have the energy to get up. And you can certainly have a family picnic with them in their room if that's what you need to do, or to just think about other ways to be flexible in meeting those things that mean the most to us during the holidays.
That's all. Thank you so much for all that, especially that last part with the holidays. What you've all said makes me feel better because she is being a therapist and she goes to a young adult group. She did start on an antidepressant recently. So I think now I know that we are heading in the right direction, and that piece on the holidays and asking her is great because I want Christmas to not be so sad as Thanksgiving was, but I'll let her drive that, I guess.
As a reminder, that is one to ask a question, and we'll move on.
Hello, how are you? Thank you for this great workshop, too, or forum. I really appreciate the information. I am a 75-year-old woman diagnosed with MDS. I went through a course of chemo, if you will, of a combination. It was a clinical trial of decitabine and ASDX, all caps, Aztec. And it was unsuccessful. It was discontinued for me a year ago. And I have only continued to gain in my count. Where MDS affects me is platelets and hemoglobin. And I'm maintaining pretty much at level at somewhere in the 80 to 85 with the hemoglobin and platelets in the mid to low teens. So fatigue is a big factor for me. Right now, I feel most days I have good energy, mental, emotional, physical. However, it seems so random sometimes that you can have a perfectly good week and then you crash. And it doesn't seem to me, anyhow, that I'm overdoing it or that I'm recovering from a especially large amount of activity or undertaking. So I guess what I want to know also from people who might have a similar diagnosis, and certainly from the panel, is does this randomness of fatigue hitting you to the point where you just can't get out of a chair one day, to being able to carry through with a lot of different chores and walking and exercise, is that typical? Have you heard this before, that it's random, that you can't point to anything in particular that changes this for you?
Yeah, and I've had patients say that it's very random. It can be random. Depends on the patient. They can't pinpoint what it is. There is some information out about what causes fatigue physically. Some of it's inflammatory, and so it can, maybe the inflammation is worse that day internally, and you can't pinpoint why. It just is. And so I don't. I think in those situations, I think you just have to accept that that's going to be a bad day, and move on to the next day and hope that that's the better day, and keeping your counts sort of on track. And if you drop below 8, do you get more fatigue? Do you notice?
And if I drop below 8, yes. We've set 7, I think, 7-0 as the level after which I get a transfusion, and for platelets it's 10. Yeah.
Okay. And you notice when you start to drift down that you're more fatigued?
I have been pretty stable with my numbers. That's a strange thing. I have not needed a transfusion since last February. So it's quite amazing.
That's great.
And I know. I think so too. But I still have that, and that's the other thing that's not logically computing for me is, okay, I go get my numbers checked every month and they stay in that range, and that's a good functioning range for me. And then all of a sudden I'll have these days when I can't move. But I think probably listening to all of you reaffirming all this is that really taking a careful look at my diet and a careful look at how much exercise I'm getting, other than just errand running, how much change there's been in those factors, and how I can help keep that more of on a steady pace. But anyhow. So that's what I was looking for. As far as inflammation is concerned, we hear and read that word a lot. Is there any way of assessing that specifically, or is it just a clinical assessment, or how do you know that that's
they're doing a lot on biomechanics of everything these days. I don't think we have enough data yet to pinpoint an exact target, but I know that's why a lot of centers are collecting blood samples throughout treatment processes, so that we can look at what is being seen as what kind of targets are in the blood at the time of certain diseases and diagnoses and symptoms, and the microbiome of your gut. So what kind of bacteria is in your gut? There's healthy bacteria and not healthy bacteria. There's a lot of new research being developed, and there is a lot of information out there, but nothing concrete to drive me to give you any good advice yet. But that is the goal. The goal is to be able to say, okay, this is what we can do to help.
Okay.
And we have no further questions at this time. Oh, you just got one. Here we go. Your line is open.
Hi, I just wanted to answer the last person. There are two tests that your doctor can do to measure inflammation, so you might want to ask your doctor. One is a measure called CRP, and one is a measure called LDH. And I have a blood cancer, and that's monitored regularly. The problem, of course, being we don't know what to do with the information because, as the person just so rightly said, we don't know how to treat it yet. But there is an anti-inflammatory diet that everybody can find online, and it may reassure you if you find out that your numbers are not as bad as they might be. So I just wanted to throw that out there. In terms of a question, I only had which you well explained, the other people never understanding about fatigue and saying, oh, I'm tired too. And also what to do when people tell you you look great and you feel like crap. Do you just smile and say thank you, or say I'm glad I look great but I feel like crap? Or, does anyone have any, you kind of want people not to overestimate what you are capable of that day.
So I can probably help out answering with that. So people in general mean well when they ask you how you are because they're concerned about you. However, they don't ask it the right way. Instead of saying, how are you, they should be saying, how are you doing? And if they say, how are you doing, you could say, you can respond with, it's been a struggle. I have good days and I have bad days, but I appreciate you asking.
Mm-hmm.
But when people just say, how are you, it's not the right question. It's how are you doing? Because it's a whole process. It's not how are you feeling that day, because it's different every single day. And it's just, they just don't understand, and they will never understand until they're in your shoes or they're in your family. So it's one of those things where it's just an eye roll. Yep, I got that question again. Okay, here I go.
Okay, thank you very much.
Mm-hmm.
And we'll take our next question.
Hi, I just wanted to respond to the latest comments and say that one of the biggest helps for me was going to we call it our wellness group. It's a cancer support group for people living with all different kinds of cancers. And that was where, for me, I could find people who got it. And that is huge in terms of getting support with those types of comments and questions.
I will echo that as well. When you're in, like I said, I'm in a peer mentoring group, and I was in a recovery group with nbmtLINK as well, where we linked, I think, about 8 or 10 people together, and for several weeks, actually for several months, I think we had a conference every once a week, and it was really rewarding to reach out and refreshing to reach out to people with same or similar diagnoses that had experiences just like mine, so I could validate that, oh, yeah, I feel crappy every other day, or, yeah, my food tastes like styrofoam, or, yeah, I have no motivation to get out of bed anymore. So that's encouraging when you can do something and you have that availability to go into a peer support group or a cancer survivors group, reach out and seek help from others. It makes a huge difference in the recovery process.
That is a very good point, and I thank you so much for bringing that up, Spin. And unfortunately, we have run out of time today, but I want to thank everyone for joining us on this call. I also want to make you aware that a survey will be coming out, and so you can look for that. And then next month, we are having a speaker from Memorial Sloan Kettering that's going to be speaking to us about having good nutrition after a transplant, so stay tuned. If you'd like any further information about survivorship issues or supports available, please feel free to contact us at the link at 1-800-LINK-BMT. We are also looking to expand our peer mentors for those that are calling to speak to someone who has been through a transplant and understand how they got through it. If you are interested in helping someone else cope with their journey, please reach out to us as well. Thank you to our speakers, our sponsors, our link partners, and all of you for joining us today. Have a great day.